Welcome to the tutorial on how to use tools to help with opening up through the surrounding musculature of the pelvis. With a tight pelvic floor, sometimes it's hard to create an environment where the muscles can relax if there's so much tightness surrounding the pelvis. So today we will be showing you how to use tools to help open up through your hips, lower back, and the arch of your foot. Let's start by rolling out your gluteal muscles. First, you're going to sit on the foam roller with your feet on the ground and both of your hands on the ground as well to support your trunk. Next, you're going to take one leg and cross it over the other. Whichever leg is off the ground, that's the side that you're going to roll your hips over to, just like you see Tina do in the video. You're going to roll back and forth until you find a spot that's tight. When you find a spot that's sore, you can even pause and let your weight sink into it before moving on to another point. Here we see Tina rolling out her IT band, which is on the side of the leg. The IT band can often get tight, and fascially it is connected to the second layer of the pelvic floor, so tightness really matters. So here you can see that she is setting herself up well on the foam roller. So first, get onto one side, put both feet on the foam roller, cross the top leg over the bottom leg, and support yourself with both of your hands. You can use your arms and the foot that is touching the ground to help roll your body over the foam roller back and forth. Again, if you have a tight spot, you can pause on it and let your body weight slowly sink into the foam roller before moving on. So now you can see Tina is going to roll out her adductors or inner thigh muscles. These muscles are important because they fascially directly connect into the pelvic floor muscles. So if there's any tightness in the inner thighs, that can cause direct tension on that pelvic floor. So you can see Tina is getting onto her stomach and forearms and placing one leg over the foam roller. She's using the strength through her arms to roll her body back and forth until she finds a tight spot on those inner thighs. Once she finds a tight spot, she pauses and then extends her knee and bends her knee back and forth to fascially pull the adductors while pinning down that one spot of tightness. This can really help facilitate a release. Next, Tina is going to roll out her quads. So you can see she gets into almost a plank pose with her thighs on the foam roller. Here, you have to have some core strength as she's using her upper body, her arms, and her core to help pull her forward and back as she rolls out her thighs. Next, we see Tina rolling out her upper back with a small pink ball. This ball can be very helpful to roll out tight muscles in the back, and next you'll see the glutes. You don't need this specific ball. You can also use a tennis ball. Rolling out the upper back is important because it helps you stand up taller and therefore get your rib cage on top of your pelvis. If you tend to have forward shoulders or slouch in your trunk, that can cause an increased downward pressure on the pelvic organs, which then would result in a tighter pelvic floor. So you can see as she just places the ball, not directly on the spine, but right over from the spine to the right or the left, and she rolls her body up and down. Lastly, Tina is using the pink ball to roll out her glute muscles. These muscles can play a big role in pelvic floor pain and tightness. So you can take the pinky ball, place it directly in the middle of the glute max or your buttock muscle, and then lean against a wall and roll around till you find areas of tightness. Once you find an area of tightness, you can stay there and either rotate the leg in and out, or you can move around in circular motion to try to release that trigger point.